My name's Adam Harris, and it's been a pleasure and an honor to serve San Antonio and the Texas community since 1997. I'm an attending orthopedic surgeon at the Spine and Surgical Hospital, and it's also a pleasure to have helped create a center for less invasive hip surgery and less invasive knee surgery here. I more or less introduced that concept into the South Texas market in 2003, and we've been building on it ever since. In my practice, I like to say that we try to treat every patient as if they were family, and that same philosophy pervades the hospital here. And so I've worked at hospitals or been in hospitals when family members have been there in many states and many different cities, and bar none, the best patient care and the best interaction with patients is right here. The three main areas that I work in are less invasive hip replacement, less invasive knee replacement, and some hip preservation surgery. Also revisions, so if someone else has done the replacement and it's not working right, frequently my partner and I can make it right. And these are all done, we schedule them through the office, we'll bring them all here whenever we can.
I think this hospital offers something unique that most places around, for sure in this community, don't offer. There's all the big hospitals and they're just big factories, but they take care of everything, And I think what's really neat about this is for the patients, they get really focused one-to-one care. You're not going to be in the hospital next door to someone with pneumonia or someone, that's really sick. You're in the hospital with other people with your same conditions. I mean, we treat orthopedic patients and spine patients, and you're here to get well. And so it's just it's a different experience for the patients, and there's really no place else around that has anything like it right now. So as one of the orthopedic surgeons in the hospital, I specialize in hip and knee replacements, and we do things a little bit uniquely here. Our procedures and our techniques are a lot different than what's out there in the community. So we have specialized instruments that many of us have kind of created and developed on our own, and we can truly say that we're the only ones doing this because we're the only ones that have them and use them. But the idea is that we don't traumatize the body as much, and we don't have to use narcotic medications to get you well. And so we want the whole experience to be, everyone's nervous about having their joints replaced or their spine operated on. But we want to turn that anxiety and make it into something positive. So you're here, we want you walking down the hall in shorts and a t-shirt. You're going to the gym to get well, you're not in a hospital like a sick person.